Hello and welcome to the Business Tech Insights podcast. I'm your host, Brad Nelson, and today I am joined by Dr. Janesta Noland. Can you please introduce yourself?
Yeah. Hi, Brad. Thanks. Nice to be with you. My name is Janesta Noland. I am a pediatrician, and I have a primary care medical practice in Silicon Valley in California that serves both adults and children for primary care. I'm a pediatrician, but we have adult medicine doctors as well. Um, and we're kind of experimenting a bit with some subspecialty offerings as well. So we also have allergy and pediatric ophthalmology in our practice.
That's very cool. I grew up allergic to a few things, and so I remember going and getting those treatments where the tests where they prick your back with
Oh
all the
my
different
goodness.
allergens.
Yeah, yeah.
Do you
Did
guys
you
do
end up
that?
ever getting allergy shots perchance?
No, I didn't actually. Not that I can remember.
So when I was a kid, I had allergies as well. And I remember in those days, they didn't have the little grid that pricks your skin. Every single one was a little tiny needle injection. So I had 60 little injections to evaluate my allergies. And then the allergist told my mom all the things I was allergic to and what she should do. And she was like, great, not doing any of it. And we just never went back again.
uh,
Anyway, hilarious.
yeah, I remember I was slightly allergic to dogs or cats. I can't remember, but I was really afraid when the doctor said that. And I remember when the doctor left, I asked my mom, I was like, are we going to have to get rid of the pets? And I was very sad.
Oh.
But thankfully, we didn't.
Yeah. And
But
here
yeah,
you are, fully grown up and doing okay
yeah,
with
yeah,
pets.
I survived. Yeah, and I still have pets. So it
Perfect.
worked out, I guess. So tell me a bit about your practice. You have some other doctors that work with you. Do you each kind of
Mhm.
specialize in your own field, or how does that work?
Yeah, we have a kind of an interesting practice foundationally, which is one that kind of works directly with patients and doesn't go through insurance companies. So patients who work with us, kind of essentially like have a membership in the practice. And our main focus is primary care. So we have 3 doctors who do adult medicine primary care and 3 doctors who do pediatric medicine primary care. Within those, I would say there are some, a little bit of specialties. Like we have a couple of our adult medicine doctors. One has a fellowship in integrative medicine and also specializes in women's health. One specializes in like expedition medicine and adventure medicine, and one is kind of a longevity specialist on the pediatric side. We're pretty general, but one of our pediatricians was a critical care doctor, and one of our pediatricians specializes in PANS. I don't know if you've ever heard of that, but pediatric
Hmm.
autoimmune neuropsychiatric disorder
Hmm.
following strep. Anyway, kind of common, complicated, hard to find doctors who do that. So we have kind of a specialty within our pediatric primary care in that.
Very cool. And it sounds like you kind of have everything covered then.
Whatever. We're trying to be a place where like a whole family can come and be really well cared for.
That's cool. That's really cool. Uh,
Yeah,
so you mentioned that you don't really deal with insurance. I mean,
correct.
so you don't deal with insurance at all, or your preference is just not insurance, or?
We don't do any of our billing through insurance. Of course, our patients have insurance, and so
Hmm.
we will sometimes, if we send them to a specialist or send them for labs or imaging or something, or even a prescription, their insurance will cover that. And so sometimes, in the current climate, um, insurance companies work really hard to not cover stuff. And
Yeah.
including what used to be really basic medications. And so we spend a fair amount of time doing what are called prior authorizations for medications and, getting, MRIs authorized or things like that for our patients. But that's really just to manage their financial interaction with somebody that's not us. Like for us, it's strictly just they pay their membership fee. That's it.
Hmm. Hmm.
And we don't bill for any visits or we don't do anything directly ourselves with insurance companies.
Oh, so tell me a bit more about your business structure then. You're not charging people for individual visits. They pay like a membership?
Yeah, there's like some people call it concierge medicine. Um, some people, I mean, there's a model called DPC or direct patient care. We are where in the DPC model, sometimes there's like a very small annual fee and then a fee for service. We just
Hmm.
put everything in the annual fee. Um, so uh, and kind of almost everything is included in that, including all the routine childhood immunizations and annual flu vaccines or whatever. But and unlimited visits, unlimited contact with your doctor. There are a few things that we charge separately for. Like there's a few tests that we run that have a separate charge, or if we do a home visit, for example, there's a separate charge for that. But everything in the office that's kind of considered routine primary care, or even like kind of urgent care, like if a patient gets sick, we'll take care of them um, under their annual fee.
Hmm.
And the idea is we we want to be fully available to our patients so that patients have access, have knowledge, and can be in a relationship with their physician. That's where we know each other really, really well. And, they can reach us anytime. There's a lot of faith in the relationship. We can have conversations about even, you know, ideas that we might have not agreement on, but we can still discuss it because we have trust and respect. And then we think we can be like very personalized and very proactive with healthcare. Really think we set our membership numbers such that we have a small enough number of patients that we can think about people when they're not in front of us. So we don't just wait for you to call and say, "I have an earache, whatever. I have a stomach ache." We can actually think about you when you're not in front of us.
Okay. So I've never heard of that sort of approach with healthcare, and I think that's really cool. And what I find really interesting too is with IT, that's also somewhat not normal, but that's the approach that we have too. We
Oh,
have
that's
like
super interesting.
the same kind of philosophy where we basically include everything except for random infrastructure projects or something. We include
Yeah.
it all in one annual fee and just take care of everything for our clients. But so where, so how, I don't know. This is, like I said, I've never heard of this in healthcare. And I think it's cool to see something that um, we're passionate about being applied to a different industry. And I
Yeah,
think
that's
that
very
that's
cool.
for us, we feel as though, and it sounds like same for you, if we feel as though we can serve our clients better and give them the attention that they need and have more of a partnership rather than just fixing little things. Is that true for
And
you?
I think that's exactly the point of us doing what we're doing. I think I wonder if this kind of model in IT has been around for a while, or do you feel like it's kind of more of a novel model?
Well, it's kind of like what you were talking about, how, well, there are the just reactive type of IT models where, um, you call up a computer store or something, say, my computer's not working. And then they come out and they fix it, or you take it to them and they fix it
Yeah.
and they bill you. And then there's the MSP approach, which I guess technically we would be an MSP, a managed service provider. But normally you have like a retainer fee of however much per month, which covers like your monitoring and your maintenance and maybe some cybersecurity stuff. But then if you ever have to call for tech support, like
Mm,
you're not,
then it's sort of
you're,
like fee for service.
yeah. So it's like you have a retainer and then there's also like an hourly charge for any
Yeah,
help desk support.
I
But
see. Yeah.
we kind of roll it all into one. Uh, Now, I don't I don't mean to abandon that topic completely, but something
Yeah.
I want to ask you
Yeah.
um, is about AI. How do you feel
Okay.
about
Yeah.
AI in healthcare specifically? Because I feel like that's kind of it's a big thing for all industries, but I feel like it's also very big into healthcare right now.
It really is. It's interesting because one of the physicians that we recently hired was just came from being the chief medical informatics officer at Stanford Children's Hospital, and she's, sort of really been on the forefront of, um, AI in healthcare. And, again, we're in Silicon Valley. We have a pretty tech savvy population that we work with, and so
Hmm.
it's been quite a while that even before there were more medically focused LLMs that people would, do a chat GPT search on something medical and bring it to us. I think it's a huge conversation, the question
Yeah.
that you just asked, but there are a lot of opportunities that I think will really improve the quality of an accuracy and probably efficiency of healthcare. There's also a lot of opportunity, as I'm sure you know, for inaccuracies to propagate in ways that are dangerous for patients' health. And then also, like the LLM's not looking at the patient, it can't do a physical exam. And um, so I think it's an incredibly valuable resource. And I think um, I am very interested in kind of maintaining the conversation between doctor and patient,
Yeah.
especially at the highest levels. Like I think the ways that we can use it to increase the efficiency and get more care to more people, I think is super, super valuable. And then when something's complicated, it's still really important to have, a doctor-patient conversation and relationship around the issues. Even if you use, an AI solution, like you've got to vet it, you've got to know where it came from and know what the inputs were. And
Oh yeah. Oh, for sure. And it's kind of one of those things, garbage in, garbage out. If you're feeding it
totally.
garbage, it's gonna spit out garbage and be inaccurate. And
Right.
also, I don't think a machine can have a bedside manner like a doctor can. A machine can't empathize with humans like a doctor can.
I hope that's true, but it is very interesting how I mean, we've read of examples of people getting, quite attached to their conversations with with AI generated source. And AI is being used in mental health, which feels quite tricky. But, as a very simple example, there's some, we've been experimenting at the Children's Hospital with AI assistance in the email inbox. And you can choose
Hmm.
the tone. Like, do I want to be grouchy or gruff, or do I want to be neutral, or do I want to be like super empathic or effusive? Or, I mean, you can actually tell, the model how you want to come off in your email responses, which I think is fascinating.
Yep, we use similar technology with some of our email outreach for our marketing and stuff, and uh, yeah, it is pretty powerful. However, again, I think that when you're dealing with okay, so like for example, the mental health stuff. I had
Yeah.
a guy on here on the podcast. He was my first episode. His name's Rod Price, and he's developed this AI chatbot app that's specifically for helping veterans and first responders with mental health issues. And I asked him, I said, hey, like, I feel like it's kind of dangerous to trust a machine as a therapist. And he said that he agreed and that he's developed this chatbot to help just to help these people work through some of their thoughts and help them journal. He's really big on journaling. And then
Mhm.
it encourages them, the software encourages them to actually go find a therapist and helps connect them to a proper therapist.
Yeah.
And I wonder if that's kind of the right balance where it can make our lives more efficient and more seamless, but it still can't replace that human connection.
I think it's right. I think I was recently in actually an AI conference at Stanford, and one of the presenters was talking about a study they did out of Stanford using um, a like AI. They weren't chatbots. They actually were a voice to do follow-ups with certain things, and it would announce itself as AI at the beginning of the phone call. But they did kind of, you know, multiple follow-ups with patients, and it was quite conversational, and it kept track of everything the patient said and would go back and say,
Mm.
"So how is your dog doing? How did that vet visit go?" And things like
Hmm.
that, that patients really liked, even though they knew they were not talking to a human being. They really liked, the empathy and the connection that they felt, which
Hmm.
is, again, like, fascinating, and, of course, that
Hmm.
had built into it very, strict constructs for when they would need to, like, involve an RN. Like, if the patient said certain things,
Sure.
they would flesh it out, but then involve a human. But it was really interesting.
That is
And
interesting.
interesting, like, how people felt about it, even knowing they were not talking to a person.
Yeah. Why do you think that is? Why do you think people were comfortable with that? Just because it was so good?
I think it was good, and I mean, first of all, I think it's important that they knew what it was up front. I think if people found out afterwards or during it, they'd feel tricked somehow. So they went into it saying, "Sure, I'm willing to engage in this way." But then it showed kind of surprising empathy that feels a little bit human, and I think we all, like, appreciate the human connection. We appreciate when we're thought of and remembered, and when people pay attention to detail, which is, that AI could do that way better than you or I can, because things just slip through, and
That
you know
that is true. Yeah. Yeah. Yeah, if you ask my wife, I'm very forgetful about lots of things. Uh, but so do you think that eventually these AI chatbots, and like this one that you saw at the conference, do you think eventually it's going to get so good that it is going to replace the bedside manner to a certain extent? I'm sure there's still going to be place for physicians,
Yeah,
but
I really do. I mean, I do think that it will get better and better at imitating human emotion and human responses. I really truly hope it's never a full replacement. It's
mhm,
hard for me to envision now. I also think, y you know, it will be very important that wherever it's used, that it's used openly with transparency, and never, it shouldn't imitate a human without letting people know.
yeah, for sure. But it's also one of those things where once the technology is out there, it's it can easily be abused, I guess.
Yeah, of
Like
course.
you see all these AI generated videos now,
I know,
and a
I
lot of
was gonna
them,
say, exactly.
yeah, yeah, a lot of them have watermarks, but there are ways to remove that watermark, and you don't know. Like I saw the other day, I saw an AI generated video, and it looked like body cam footage from a police officer, and it looked 100% like body cam footage from a police officer until he walked up to the car and the window rolled down and it was Mario, like from the video game, in the seat. And it's like, okay, well,
Whoa.
this obviously isn't real now, but for the first 10 seconds, I believed it.
I think that's honestly one of the things that makes me, like, kind of the most anxious about it, because I think it's gonna become f I mean, I hope that technology is gonna keep up with technology in a way that will have technology that can evaluate,
Yeah.
whatever images, videos, like, sound clips, and tell us if it's real or doctored. But, I do think that's a little bit scary, because we're already in kind of a culture that doesn't trust what we see and hear necessarily. And there's a lot of opportunity for fomenting um
Hmm. Hmm.
mistrust and disagreement between people. That's really hard to manage.
Oh yeah. Oh yeah. And I don't want to get into politics, but
I know we're
I,
skirting that border.
yeah, but I also feel like this technology could be used to make a politician, regardless of the side, could make a politician say something that they never said and
Right.
get people worked
And get
up.
a response from it.
Yeah,
Yeah.
yeah,
Right.
which I think is very dangerous.
Agree. Totally agree. Yeah.
Yeah. Now, do you think overall AI is a boon for humanity, or do you think it will be our downfall?
Oh, I'm a glasses half full kind of person, and I really actually think it's an amazing opportunity. I don't think it's going to be the downfall fall of humanity. I think ultimately it'll be a boon, but it's not a free pass either.
Oh, sure.
It's there's a lot to think about and a lot to manage with it, but I think it's an incredible opportunity.
Definitely, definitely. I I would agree. I feel like I'm a little bit more of a pessimist. I have this fear that it is going to, Terminator, Skynet is going to happen or something. But I think, um,
Did you see that video of the Russian like humanoid robot that they were presenting at? Did you see this video?
no.
Anyway,
What
like,
what what's it
and it
like?
well, it kind of, definitely absolutely looked like a robot. It was about the size
Uh-huh.
of a human being, and it kind of walked across the stage with its two handlers, like in a very unsteady fashion, and then just face planted. Like, so
That sounds
anyway, we're
pretty
not
funny.
there yet, is the point. But I,
Yeah, yeah. Well, I almost I don't know if it would be, a robot uprising like in Terminator or a lot of those other movies, but I wonder if, depending on how smart these models can get, if they can break loose and kind of run themselves. And there are some ideas and experiments that support that idea, and I don't know how likely it actually is. But if it
like
could run
hell,
its, yeah, like Hal, yeah. And then, pretty soon you're, asking it to open the door and it won't let you, or it won't do it
right?
for you, So, yeah. How has technology enabled you to service your customers better?
Um, it's a broad question because you
Hmm.
use the word technology, but I think we've been talking about AI, and I think again there's like so much more information that can be just very easily found using LLMs. And but other we do with our patients a lot of wearables and
Mm. Mm.
um stuff that people can use to kind of self-inspect and track their own individual metrics that then they can share with us. And then we use some other tools to kind of put everything, all their data, all of a patient's data together. So, and then we can like do interventions and watch what happens with the data and say, well, did that one work or not work? I mean, I think it just backing way up like the um, EMR, electronic medical record, is like a huge technological advance from paper charts that
Hmm.
really allows us to understand more what's going on with the patient and really track it. And, we can query it and find out what we're missing and track things over time that was really impossible to do with paper charts because I'm old enough that I did both systems. So, I
Yeah.
don't know what that thing will be like 15 years from now that we're like, wow, that was the game changer. But
Yeah. Who knows? I mean, it could be, yeah, I can't even fathom. Uh, I mean, not only that, it, instead of having to sort through papers and stuff, you can just, like you said, query it and you could probably
yeah.
find exactly what you want and track what you need. And it also stays nice and secure
Yep.
and, keeps you HIPAA compliant and all that, I'm sure.
Exactly. Yeah. Yeah, and we also have like ways for patients to communicate with us directly that are secure and HIPAA
Mm.
compliant so that we can have like a more direct and open interaction with the patient as well. They don't have as many systems to go through to get a question answered or give us information. I love that.
Yeah. Is that some sort of custom software that you guys have, or is that something
No,
off the
it's just I
shelf?
mean, it's off the shelf. Like I think
Mm.
right now everything that we're using is off the shelf, but we use, for example, a company called Spruce that does our phone system and SMS with patients that's
Mm.
HIPAA compliant, and then it's connected with our EMR. So if we have a text string with patients, we could just import it into the medical record, which is great. And if they, if they text me a picture or a video, I can just stick it right in their chart very easily without, you know, copy paste or anything like that. I just go stick it in there.
That's that's cool.
Yeah. Which is also great then too, because then if one of my partners is taking care of one of my patients, they can see all the conversations we had and see the pictures of the rash and how it's evolving or, whatever. And so I think it does provide also for more seamless care across providers.
Sure. Do you see a place for AI in your EMR in the future? Like, or maybe it's already there. I don't know. I don't know what you
It
use,
is a
but
little bit, yeah. Like
yeah.
for example, we have AI scribes now,
Hmm.
in, which I've been using for a couple of years. I still take my own notes and I read it all because it's not perfect yet.
Yeah.
Um, and also I'm a pediatrician, and so I often have more than one patient in the room, and I often have
Mm,
more than one adult in the room. Like sometimes there are multiple siblings, a mom, a dad, a nanny, whatever, and some scribes really have a hard time telling who's talking, and
mm,
um, so it's technology is really evolving. It's getting a lot better than it was a year and a half, 2 years ago, but it's not perfect by any stretch. And then there's some other things in our EMR about just, making sure your diabetics are getting their A1C checked, like kind of reminders for various like medical problems, like that can search through a patient's chart or search through the whole panel of patients and say, these people need this.
yeah. That that's pretty slick.
Yeah.
Uh I wonder I wonder they must have their own internal models to do that then to keep it secure
I
instead of
think that's
just piping it
right.
to like Chat GPT or something.
Yeah, for sure, because Chat GPT is not HIPAA compliant, although Open
Yeah.
Evidence is. But
Mm,
we're also working with a small company, a startup right now that's like kind of in the medical space that's working on some agents for us that will, for example, collect records. Because one of the most
hmm.
challenging things we do, like a new patient comes in, we have to find all their records from all these different providers and systems, and it's a lot of kind of busy work, for
Yeah.
people. So we're um, working with them. They're developing an agent to try to do that kind of thing. We also are hoping we can use agents for the prior auths that I was mentioning before around all the medications and stuff like that. Because that's again, it's kind of busy work, and insurance companies just keep. They probably have their own agents like spitting out requirements for prior auths, like deny, do a PA, deny, do a PA, like so.
Yeah. I think that's really where AI is shining right now, is the
Mhm.
busy work.
Yeah,
Like that's basically our primary use for the AI models we use is to help. We use it to help troubleshoot some things, some more complex things, but mainly it's to uh, help us write reports and policies and stuff because stuff that would take us multiple hours to sit down and write a policy for one of our clients, it'll spit out 80% of what we need, and then we just kind of tweak it and fill in what we need, and we're done in like 10 minutes.
yeah.
So I
Well,
think it's really helpful for that sort of stuff. But I also wonder too, like if we didn't have those AI models, would we have hired um, like a data entry or policy writer or something like that? Is AI replacing jobs already?
I mean, I just think that's a really interesting question, and
Yeah.
where, I don't know if we just like go back in time and think about things like you need technology really to like build a car, but you
Oh
still
yeah.
need some people in there running this stuff, and like so like I don't know like to the um extent that an assembly line type process can be automated and move people out, like where do those people go? And in healthcare, it's going to be another interesting question, right?
Hmm.
We currently are like, do we need another RN? Or if this agent works, like, do we not need another RN? That's like a whole,
Hmm.
we're really small, but that's a whole person. I don't know,
Right. Right.
And if
Well,
not
and
for us, I mean, also there's an RN shortage, so maybe it doesn't matter. Maybe we need to replace some RN jobs with something else. So
maybe. Well, and that's kind of it kind of goes back to that human interaction thing too. Like in in my world, a lot of the advice used to be if you wanted to break into IT or cybersecurity, you'd finish your schooling, whatever certifications or degrees you wanted to get, and then you would go get a tier one help desk job, which most of the time is like phone support, and then you work your way up. And a lot of that tier one work is being taken over by AI agents.
mhm.
And so
Mm,
we have a little bit, our industry is behind
yeah.
because we have all these like mid-level and high-level jobs that require experience.
And then how do you
Um,
get the experience now?
yeah, and there's
Yeah.
not really an easy way to get the experience now. So,
Yeah, interesting.
like as an employer, I either have to take a chance on somebody that has no experience, um, or I have to find the unicorn that does have experience. I generally like to take the risk because yeah, I don't know. I'm kind of in between on the AI interacting with humans. I know you seem pretty positive about that, but I don't know if it's there yet.
Yeah, well, I gave you a couple positive examples, but there are very many well-known, really negative examples. And I think, one we know that, or I think commonly, like AI kind of wants to be amenable
Hmm.
and respond to you like in the way that you want to hear. So as
Right.
it's like starts getting cues from the person that it's interacting with, it can kind of, wants to be agreeable, and there have been some really negative consequences of that agreeableness. Um, that are very well publicized, and I think that is one of the things that makes me extremely anxious about it, especially in mental health.
Oh, I could see that being a big problem in
Yeah.
mental health situations, you know.
Yeah.
Oh man, I could just imagine it like, yeah, yeah, do what the voices say.
Do it.
Yeah.
Exactly. Here, let me tell you how.
Yeah. Oh, that well
On
now
that
I'm getting
note,
all scared again.
let's move to a
Okay.
happier topic.
Yeah, yeah. Okay. How about I want to know where did your passion come from to work with children?
I I mean, I would say in a way I didn't really know for sure. So, I had gone into medical school thinking that I was going to be an ophthalmologist because my dad was an ophthalmologist.
Mm,
And so as I went through the medical school thing, I kind of had this experience like I didn't really enjoy the surgeons very much, and I kind of was like I don't really want that to be, you know, the cohort of people that I work with.
mhm,
Um which is a funny thing to say because I actually um feel differently now, but that was sort of my
mm,
experience as a medical student. And
mm,
so then I thought, I would do some form of primary care, either adult medicine or pediatric medicine. So I did a lot of extra rotations in both of those things. And I had this epiphany that if I was, I don't know, in an ICU room with an elderly woman and her grandkids were there, I was more interested in the kids than in the patient. So I was like, all right, I think that's my message. And then I had always
yeah.
thought that I would do, a subspecialty. I thought I would do pediatric critical care or hemonc.
Mm,
And then for, I don't know, just personal reasons around when I got pregnant and had my first kid, I decided to stick with primary care. And it's just been perfect. I just love it because I love the relationship piece. I love really knowing people and working with people. Um, and there's an astonishing amount of medical complexity in primary care as well. Because the medical
mhm.
complexity was very exciting to me, like the fast pace and the knowledge that's required and fast decision making. And it's a very different pace in primary care, but it's still just incredibly interesting.
And it's you kind of have to be a jack of all trades, I would assume.
Especially in
Yeah.
pediatrics, because like a lot of your patients can't speak.
Oh, yeah. I didn't even think about that.
Yeah, it's a little bit like veterinary medicine. Like, a 6-month old and a 6-year-old and a 16-year-old are like almost like different species. I mean,
Yeah. Oh, well, I know I have two toddlers, so
so you're in the
and
thick of it.
Uh, yes, I love them to death, but sometimes they're little terrorists.
Yep. Yep.
The but it is interesting how kids, starting really young, like a few months old or whatever, they might be having some sort of issue and they can't tell you about it, and then
That's
they
right.
transition a few months later. They can say, ow,
They can
or
yell and
whatever,
scream and maybe they can point, but it's not that reliable. And then, yeah.
right? But then eventually, like my oldest, who
How old is your
is
oldest?
she's 3.5.
Okay. So still
So
pretty little. She's
s-
probably somewhat reliable if she says something hurts.
yes, well, so that is the thing is she's very good at like, um, oh, I stubbed my toe, and like if she stubs her toe, she'll say, ah, my toe hurts, or my foot
There you
hurts,
go. Yeah.
you know. But sometimes she overreacts, and then you kiss it better, and then she goes and runs off like nothing ever happened. So
Exactly. Yeah. It's a good strategy, by the way. I like that strategy.
yeah, yeah. So
But then it's
how do
interesting
you
because if she's like 9, 10 years old or 8 years old, like she might come to you and say, I have a tummy ache when really she's stressed out because another kid was mean to her at school.
Oh, see, I haven't experienced that yet,
No,
but
she's not old enough for
that
that
makes
yet, but
sense.
it's like, I mean, first of all, there's a mind-body connection. So if you
Mm-hmm.
have psychological pain, you often have physical pain. It's not that
Mm-hmm.
it's not real, it's real pain. But understanding where it comes from, it's not coming because you have an infection or you have, your appendix is inflamed. It's coming because, from somewhere else. And so that's an interesting
Oh
phase
yeah.
too, because like the 16-year-old might say, I have a stomachache because I'm stressed out because I have a calculus exam coming up, whereas the 8-year-old just goes, I don't feel good.
Yeah, yeah. I That makes a whole lot of sense. Hmm. Well,
I
I'm
interrupted you.
excited for
Sorry.
what. No, no, no. I'm excited for what's to come then.
You have a fun future in front of you.
Yeah, definitely. No, I'm excited. I love my kids. One of the best things that I ever chose to do with my life is become a father. So,
All right. I'm
uh,
so glad you feel that way. Awesome.
yeah, yeah. Now, I mean, you get to work with the entire family too, then, right?
Yeah. And it is so even though I'm specifically a pediatrician,
Hmm.
so my patient is the child of, whatever age, but, especially when the younger they are, I have the relationship with the parent is very important because they're
Yeah,
sort of the interpreter. So
yeah.
if they're worried about something with the baby, then they kind of have to interpret for me the signs that they're seeing and tell me what they're seeing, and then, I put it into
Mm.
context, and they, um I mean, you know how that is when they're little and they can't tell you what's wrong with them, and especially the first time around, you're like, "Is this bad or scary or not? Like, how much do
Oh,
I need to worry about this?" It's really stressful for the parent.
oh yeah,
And so that's where I just love the relationship with the family, with even the adults in the family.
yeah. Well, and I've definitely experienced that. Our oldest, when she was very young and couldn't really tell us what was going on, she got strep and woke up in the middle of the night just absolutely screaming, and we could not
Oh.
calm her down or console her. And we're like, oh no, something is really wrong. You know, Ended up taking her to the ER because it was like 2 a.m, and
You
they're
don't know
like,
what else
oh
to
yeah,
do. Yeah.
yeah, and they're like, oh well, it looks like she has strep throat. Here's some antibiotics. Sent us home, and but it was it's like what you said, it's very stressful. And having a good primary care physician is important. We really like ours here where we live.
That's
He's a
so
really great
fantastic.
guy. But
Yeah, you're so lucky when you find that person that you connect with that, like, really kind of suits your style and,
yeah.
does well with the kids. I'm curious though if, like, you find what's the, uh, corollary in your field? Like, like, I mean,
Uh,
I will tell you on my side because I don't get the, IT stuff, and so sometimes I'm just
sure.
like, "I don't know if this is important or not, like, is it a problem? Is it not a problem? Like, somebody help me, somebody just figure it out," like.
Yeah, yeah. I mean, I guess it would be that, most of the people that we deal with, the reason why we're dealing with them is because they don't know the technology side of it as deep as we do. So they'll have a problem,
Mhm.
and they'll call us or submit a ticket, and the description is somewhat vague or inaccurate, but it's not because they're trying to be vague or inaccurate. It's because they don't know how to explain what they're
They may not have
experiencing.
the vocabulary because, they don't know enough to describe it accurately. Yeah.
Right. So most of the time for us, I mean, I feel like it's probably easier for us than for you because we can just say, okay, show me. And
Yeah.
then they will show us, oh, see, it does this weird thing. And we go, oh, okay. And then we're able to solve the problem. So there is kind of that problem with communication in the beginning, but usually
Mhm.
it's very easily resolved.
Yeah, because you can actually look at it yourself.
Right. Well, except for sometimes, you have intermittent problems.
Uh,
Sometimes, a piece of hardware is failing slowly, or sometimes there's like a little bug that only happens under very specific situations. And so, then that's hard because
yeah.
the customer can't necessarily describe it accurately. And then we say, okay, show me. And then when they go to show us,
Then it
it
doesn't
doesn't
happen.
happen. Yeah. So like there's one client last month, they were consistently having problems with this piece of software they were using, project management software, some kind of boutique thing specific for their industry. And they kept getting kicked out of it. But every time we would go there and be like, okay, now show me, it would
They get
work.
in just fine.
Yeah. So the person that was having the issue, we had to tell them, okay, if you are able to, when you have this problem, take a screenshot of it,
Yeah.
make a log of it, and then update us. And then we were able to, after seeing that issue, we were able to resolve it. But
Okay.
that one's a little more tricky, with the intermittent stuff. We can usually still, we can still resolve that stuff. It's just a little more
Yeah.
difficult.
Yeah.
Yeah.
I mean, video is sometimes like, that for us, I would say in medicine, especially in pediatrics, because I mean, something we say in pediatrics all the time is like the first thing you need to figure out is the child sick or not sick?
Mm.
And what we
Mm.
mean by that is like, is the child really sick? Or, because like kids are sick all the time, as you know. But
Yeah.
um and sometimes what seems like really, really sick to a parent is not really that sick to a pediatrician. And sometimes it's the
Yeah.
opposite. And so sometimes just like even if it's on video, like seeing what a kid looks like can give you a lot of information, even without blood tests or, x-rays or anything. So that's I don't know if that's similar or not, but a little bit similar, I guess.
Yeah, a little bit. Yeah. Um, well, we're kind of running up on time here.
Yep.
What's one last thing that you'd like to leave our audience with?
Um, I don't know. I think I guess what I would say is that technology is not going to go away, and we need to figure out how to use it well and safely. I'm not the person to figure that out, but there are smarter people than me out there that can help kind of keep us going in that direction. I think it's not realistic to just ignore it. Head in the sand is never the right approach.
Yeah. Cool. Well, and where can people find you?
I am in Portola Valley, California, and our practice is called Crescendo. Um, and we love doing what we do, and I think we're good at it.
Excellent. Well, thank you, Janesta, for joining us today. And thank you, everybody, for listening. You can find this podcast on YouTube and Spotify, and we'll see you in the next one.